I'm Fabian, and I'm against that terminally ill patients should have the right to pursue physician suicide. 3 points are that they shouldn't have to stay alive if they're not living at top quality. It doesn't always have the patient's best interest in mind, and that doctors assisted suicide, where it's legal, it puts people's pain away and is successful. Basically, she said that they shouldn't stay alive if they're suffering. That's not, they are suffering, however, there are fixes for this, such as palliative care, which palliative care basically is when it focuses on the patient's It focuses on making the patient's life better in quality, and it significantly lowers depression rates among them, and that's palliative care. And there's also hospice, which is part of palliative care. Hospice is for patients who have, according to doctors, less than 6 months to live, and with hospice, it is their duty to keep the patient comfortable, as free as possible from pain and symptoms, and allow him or her to maintain a good quality of life for the time remaining. Hospice accepts death as an inevitable outcome for a patient with a terminal end-stage illness. In hospice, both the patient and the family are the focus of the care. With euthanasia, all you're doing is getting rid of the pain, and you allow the loved ones lose somebody, and they might not be ready for that. And those who go through palliative care genuinely live longer than those who don't go through palliative care. So there was a study that Medscape found that the median survival for patients without palliative care was 8.9 months, and those who had palliative care lived approximately 11.6 months, a 2.7 month increase. And then she says that it does not have the patient's best interest in mind. However, that's not necessarily true, because if you put euthanasia on the table, then the patient is kind of pressured into it by family if they don't want to take care of the sick person, and they don't want to help carry the burden. And another way is that the person who is sick, sometimes they feel they feel dependent and often worthless, and feel like they're burdening their loved ones. So they're being pressured into doing such thing as euthanasia. And even though she says it could be controlled, it's really hard to draft such laws in order to control euthanasia. As for example, with in the Netherlands, it is currently accepted. Euthanasia is currently accepted, and the thing about euthanasia in the Netherlands, because it's on the table, there's no such thing as palliative care in Netherlands. It's virtually unknown, so they never take the option to alleviate their pain, but end it completely. And then there are cases where basically it's going to lead to legalized murder. Dr. Badwin Chabot assisted a suicide in the Netherlands to a physically healthy patient who was stated by the court to have a depressive disorder in the narrow sense, and it was allowed to happen. So if you continue with euthanasia, it'll eventually lead to the point where you can't control it, and it'll lead to something else. And then she says doctors assisted with such as places like Netherlands, where it makes the pain go away. Doctors aren't always right, per se, when they say that you have this terminally ill disease. There's a study, a 2005 study, that basically said doctors are often 10 to 50% times wrong on the autopsy, it shows. And this basically says, like, if you have euthanasia on the table and you take it right away, you never see the long-term results. The doctor could have been wrong or right, and that's why you have to go through the palliative care. to see where you're at, and it helps you with the suffering, and it helps your family with the suffering. And another thing she brought up, that they shouldn't burden the certain percentage she gave, said that they wouldn't want to burden with financial needs. That necessarily isn't true with palliative care, as most nonprofit hospice agencies have options for patients who lack average insurance and will provide the patient free of charge or at a reduced rate. Another one is the study found that Medicare and Medicaid paid 78% of home-based hospice charges in 2008, with 12% being supplied by private insurance and 10% being out of pocket. So there isn't an excuse not to go through palliative care because of financial reasons as well. And yeah, thank you.